This was a different type of, I guess, a speech that we have heard from Christie. It was a long speech, and I can tell you, nobody can disagree on the epidemic on drugs that there is, and drug prevention and treatment. Drug treatment is something that we can all rally around, and I think it's very important. And again, I am proud to work with him on trying to make sure that everybody that has health insurance gets what's due and not get denied of coverage to be able to get those treatments that are very important. Saying all that, I actually welcome for him to join us in making sure at the federal side, the Affordable Care Act that actually has expanded to so many more residents of New Jersey with a Medicaid expansion, like over 500,000 residents have additional coverage, that we make sure that that stays in place. So I look forward to his partnership with us to make sure that that stays a reality. And I think, again, nobody would disagree on this issue. This assembly has passed numerous amount of bills to make sure that all these things are done in a timely fashion, because it is a definitely epidemic we have, not just in this state, it's national, but in this state it's really, many municipalities are under siege. Saying all that, we still have a lot of other issues that weren't talked about. And as a state of the state, he talked about that this affects people. That's sort of the end of his speech. There's a lot of other things that affect people in the state of New Jersey. And when you talk about his tenure during the last 7 years, and you can talk about all the different things that have been overlooked, as New Jersey Transit, over 30% has risen. 70% of school districts are receiving less money than they were in 2010 when he came in. Property taxes have risen over 30% during that period of time. There's many challenges the state of New Jersey has going forward, and has as part of their snapshot in the picture of the state of our state today. A lot of things that were highlighted for him, the good things that were done on some property tax fairness, all came together with a TTF. So that's all great, but there's still a lot of work to be done for the state of New Jersey. So I think, moving forward, we're going to love to partner with him to make sure that affordable care to all the residents of the state of New Jersey is there, and look forward to making sure we fight for drug prevention at every level. Majority Leader, want to say a few words?
Thank you, Speaker. I thought it was an excellent speech. I think his opening really around a lot of the progress we've made on tax fairness that took 6 years in the making was really because we were able to get to a bipartisan effort around it. It was about tax fairness for all people, not just the rich. When he talked about retirees that are leaving the state, a lot of public workers and their pensions who would leave the state, senior citizens, veterans, these are areas that were critically important to our leadership and the members of our caucus, and combined with the need to drive our economy by rebuilding our infrastructure. To us, this was a key component of the beginning of what we hope is some real bipartisan effort. And I applaud his focus on this issue of addiction. I think if the work that we were able to do together as Republicans and Democrats to find a pilot program around tax restructuring in New Jersey that was broken, if we can come together and understand that addiction is not a Republican or Democratic issue, it's not a rich or a poor issue, that it is an issue that can affect any family at any time, it would be a wonderful way for him to spend his last 373 years working together as Republicans and Democrats. What's that?
Days, not years.
Oh, years. I'm sorry, days. God help us all. It just seems like years, but we're happy to have that narrowed down a little. I will tell you, I think what's important is there's a number, he pointed to a number of bills, including the 10,000 lives that were benefited by legislation that was passed. That was legislation that was sponsored by members of our caucus, again in a bipartisan fashion. There's a bill on his desk today that talks about prescribers of medications of opioids, sponsored by Assemblyman Lagana, Assemblywoman Pinkin, Assemblyman Moriarty, and others, that talks about the prescribers educating the user of those opioids of the possible addiction and what that means to them. And what we know from addiction, what we've learned through this process over the years, obviously, is education is a major component of this. So working together and encouraging him to sign that legislation, working with him on the legislation that he talked about is critically important. We also know some of the things that drive people to the use of illegal drugs is we have an increasing level of poverty amongst children, a 13% increase of poverty amongst children in this state. Those children of poverty will ultimately turn, we see statistically higher, to a level of drug use. We need to work together in a bipartisan fashion as Republicans and Democrats to attack that poverty issue led by our speaker. We need to understand that we have a disparity of funding in our public education system, and we have to work together to address that because it is an over-reliance on property taxes funding public education that is forcing so many of our residents that the governor talked about to ultimately leave New Jersey. That led to the bipartisan tax relief programs that we talked about. So there are true issues that this state faces. I think he was right to talk about this level of addiction. New Jersey faces the highest in the country. I was touched. I know AJ and his family. You know, I started my career here in the state legislature when I actually beat my friend Lee Solomon for the assembly seat. Lee went on to become a Camden County prosecutor, an attorney general, a judge, member of the BPU, and a justice. And over those 22 years, I have been in the state assembly. So some would say for Lee Solomon, it's been a remarkable career path for him. And he is my friend, and I am touched by AJ's story. I think it is important to note that that story is not unique to AJ, and that this is something, again, as we said earlier, can touch anybody from any walk of life. So we are passionate about this issue. You'll hear from our colleagues who have advocated for this issue much of their political life. We can work on this issue together. We just need to recognize that the roots of this issue lay in issues of education, access to health care, poverty, and job growth that is also critically important to our members of our caucus that we look forward to spending the last 373 days with this governor working together in a bipartisan fashion. So thank you.
First of all, I would like to tell everyone in the room how I feel about this issue because born and raised in an urban atmosphere, I've seen it all. So I'm happy that the governor was smart enough to recognize we do have a problem. Curing an individual is part of the problem. Preventing the problem is another part. And that's the part I'm not here. What are we going to do? And I'm hoping he used that number he just mentioned he has in his pocket. Because the day we stop the supply of drugs coming in our community, that's the day we turn it around. Because in urban community, it has become a way of life in terms of making a living. People feel nobody cares. So talking about the fact and all the stories were very touching because I've lived through a lot of those stories where I've seen innocent young children get caught up and before you know it, their life is destroyed. I would like to have heard more about what we're going to do to stop drugs from coming into our communities, especially in our urban communities. The biggest businessmen in our urban communities have to be drug dealers. So when you're talking about curing, I'm all supportive. But not one time did I hear anything in terms of we're no longer going to tolerate drugs in our suburban community. Because see, now it's in our suburban community. And that's why it's getting a lot of attention. But if I say to you as a young man, I actually have seen drug deals go down in front of me. And it was almost like nobody cared. But since we care, let's care about everybody. Because of the fact that we can't tell people we're going to put you out of business, we want you to do something with your lives, unless you're going to be able to get a good job. So again, I want to see the government on a national level, state level, and I don't mind making it very clear, if you want to sell drugs in this country, it's the price you got to pay. The same price we want to pay to get somebody cleaned up, I want us to pay that same price to get drugs out of our community, because it's destroying lives and it's taking away what I consider ability of an individual to look for a future. So if we're going to talk about curing, then we got to talk about prevention. And it's going to start at the White House. We can no longer take this as a light issue, because even in my county, the majority of the deaths now are behind drugs. And if government don't step in to stop it, I don't care how many treatment centers we put together here in this state, it's still not going to stop the problem. The problem is we have to eliminate drugs in our community. I would like to see a lot of energy put into that area. Thank you.
Good afternoon. So I was pleased because as a 15-year career mental health professional, to hear an executive talk about mental health advocacy, addiction treatment is long overdue. It's part of the reason why I came to the legislature. When we talk about putting restraints on prescribers of opioids, that's something new that hasn't been done, that hasn't been tried, where an attorney general will actually restrict the payment for prescribers of opioids. That may be a game changer for us. So I'm looking forward to see what that legislation will look like, and possibly to be a sponsor of that legislation through the speaker. Also understanding that addiction crosses all paths, not just urban, but also suburban and all walks of life. Too often, we like to sweep it under the rug. We also like to say that sober houses, which is something that our House and the Democratic Caucus has championed, for sober living houses to be available in New Jersey, so people would not have to travel to Florida just to use their health care benefits so that they can get addiction treatment at an affordable rate, is unconventional. How do we support more of them coming into our state and into our communities? How do we deregulate some of our communities so that we can have safe, sober houses within the communities and not just concentrated in blighted urban areas? And then we need to talk about our criminal justice system with reforms, which we've been working on, signature legislation, earn your way out legislation, where you can get credits and not stay incarcerated for minor offenses such as drugs. So we're really on the cutting edge, and I'm excited about today's message, but I am looking forward to what the next 363 days will look like for this governor. If we combat poverty, if we start talking about the joblessness, if we start talking about the hopelessness and move towards a pathway of hope, our state will be positioned so that we can move towards another successful 4 years, if you will, under Democratic leadership. And I'm also looking for our governor to talk about women's health care. When we look at the federal government and talking about detangling Obamacare, as they're phrasing it, the impact on New Jersey, the impact on healthcare providers, the impact on the people who've been able to actually receive treatment because they have Obamacare, expanded Medicaid, has allowed for them to seek treatment. So if we talk about rolling the clock back, if this governor has a number to someone in the White House, I hope he uses that resource so that we can keep those systems in place to make sure that we continue along the pathway of making sure that women and people and our children have greater access to health care. I'm looking forward to this year and to working closely with my Democratic colleagues, as well as this governor and the advocacy community on mental health transitions for combating this epidemic. Thank you.
Good afternoon. When the governor opened his remarks today, he spoke about his constitutional requirement to report to the legislature as well as to the people of the state, and to report to them in terms of the past year as well as plans for the future. I'm not quite sure what we heard on both sides. Certainly, we all praise and laud the governor's position that he is taking, and I believe this legislature under the Speaker will follow his lead in terms of drug and drug addiction. It's certainly something which is not foreign to this Assembly, but something which, as the Majority Leader had stated, we've been championing for years and years and years. But the governor said there is a crisis destroying families. I live in an urban area, and I know the crisis that is facing our families in terms of drugs. But I also know there are other challenges ahead which were not addressed by the governor, unfortunately, in terms of where do we and how do we as a state move forward. College affordability and the exceptional and incredible debt load that so many of our children face upon graduation or worse, non-graduating after years in the higher educational system. Providing jobs to New Jerseyans, well-paying jobs, expert jobs that take advantage and utilize our educational system. There are so many issues that are facing this state budgetarily, so much, as we all know, which I'm sure will be addressed by the governor shortly at his budget address, but the fiscal insolvency of the state in so many areas, which we're all too familiar with. The state has challenges. We applaud what the governor said today. The problem is there are other things that need to be spoken about as well. Drugs needs to be a central focus. New Jerseyans are dying each and every day. But we also have other challenges before us. Poverty, homelessness, those people who need a roof over their head are as challenged as others, and they are our responsibilities as well. I fear that if we focus only on one issue, we will forget about the others. And I think that we need to take the attitude that we as New Jerseyans can handle, can attack, will attack those issues which confront us in terms of those better paying jobs, in terms of making New Jersey a better place for everyone to live. Those things are within our grasps. I applaud what the governor did today. My only concern was that he did not do enough. He did not hit issues which are central to the core basis of New Jersey and New Jerseyans' life. I would hope that in the further year that he is serving as governor, that we can get from him direction in those critical areas as well. Thank you, Mr. Speaker.